one time, and I was a tomboy, ever
Yep.
thought I might have should have been a boy.
Right.
Oh, I'm sorry. Oh my gosh. You guys are gonna kill me.
That wasn't live.
I, it
That
wasn't,
wasn't
was it?
live. Oh my gosh.
We're 17 minutes in.
Oh my freaking gosh. Are you kidding me, bro? Oh, I'm like, I'm like going over all this stuff, and I'm like, we're going over all this stuff, and I'm like, we're not live yet. Oh
I see it
shit.
35 minutes, seconds in.
Oh wow. I'm sorry. 35 seconds, 35 minutes.
No, second. It's 44 seconds now.
42 seconds in.
Oh my gosh.
45, yeah. I just saw the live thing myself.
Well, we could do a recap.
Okay. All right. Recap. Should we do like Enz Ventura? You know how he's sucking up the air. He's like,
Okay.
guys, audience, I'm sorry. I'm really sorry. Oh my gosh. Everybody's like, dude, what happened to your broadcast, bro? Okay. Oh my gosh.
It's
Okay,
fine.
so
Take a breath. You're good.
all right. So okay. All right. So all right, for now, we're gonna go over this here.
Okay, Josh.
Okay. Yeah, I got it.
Okay.
Popular curriculum for 4 to 6th graders covers puberty blockers and says gender is non-binary. So basically, wow, I thought we were live, guys. It's a school in Seattle that it's called a Flash program. It's called the program is called Flash, and basically teaches people about 4 to 6th graders, not people, there are people, 4 to 6th graders, children, puberty, and puberty blockers. So Flash is a sexual. It was directed towards the teens. Developed by the Public Health Department of the Seattle City of Seattle, King County. Can you guys see that here?
Mm-mm.
There you go. Now you can.
Not yet.
There you go. Yep. Yep. How about now? You guys can see that now.
Yes.
Okay.
Not yet.
All right.
I can't.
Now I'm gonna share it again. Where's Homer at? He showed the shit out of me right now. Anyway, so yeah. Can you guys still see it or no?
Yes.
Okay.
Yeah, I can now. Yeah.
Can you see me scrolling?
Yep.
Yes.
Okay, cool. All right. So the school out of Seattle Flash program, as we all know, like I said before, it's teaching us the 4th through 6th graders. And it says some people decide with the help of their doctor to take medicine or hormones. Like basically the teachers are teaching this, starting this conversation this way. Some people decide with the help of their doctor to take medicine or hormones to change puberty on purpose to better match their gender. The Flash curriculum lessons on puberty reads, they might take medicine that interferes with hormones so puberty changes don't happen at all. Or they might take medicine made of hormones so they have specific changes. Let's think about the kinds of changes that might happen to someone during puberty. And that's the conversational part that they're saying to kids. And it says after wrapping up that discussion with students, teachers are instructed to create 3 columns on the whiteboard. One for people with penis and testicles, boys, and another one for people with uterus and ovaries, and a third column for everyone. Students are then expected to fill in the appropriate columns with their corresponding pubertal changes. I'm sorry. So yeah,
That's a word. Pubertal.
Yeah, pubertal. Yeah.
Oh, it's an interesting word. Never heard of that one.
Yeah, neither have I.
Pubertal.
That's weird.
But we're always still, I mean, it's at the 5, 6, 7, 8, 9, 10, 11-year-olds we're talking about. It's just, it still blows my mind.
Yep. Yep.
Well,
Nobody
It's-
should be
it's
talking
the
about
thing.
this to children, but the parents.
Yes.
exactly.
I'm sorry.
Well, I just
Yeah.
I want to fix it and be like boys, girls.
Yeah. And girls. And then forget about the other one altogether.
Yeah, why is
Yeah.
there even a third column?
Yeah. Well,
Yeah,
that's
exactly.
it.
That's it. There's boys, and they have a penis, and,
And
girls have a vagina.
Yep.
It's very simple.
Absolutely. We don't
Until
need
they
to be
get
splitting
twins.
hairs.
Yep.
Right.
And it said here the sperm production and nocturnal ejaculations were the only changes discussed at the curriculum indicated occur in people with a penis and testicles, boys. And I'll say this again. I looked up the definition because I'm always looking up definitions periodic, like most of the time, because they even changed the definition of a woman. I don't know if you guys heard that. They changed the definition of a woman.
Yes. It's enough to piss
like-
you off.
Exactly. And it's like why like you guys said earlier before I pushed the live button. It's like, why are we teaching this to 8-year-olds, 7, 8-year-olds?
Yeah. No.
I mean, this is crazy.
And like you said, there's no good reason for this unless you're grooming them.
Exactly.
Because kids at that age
Right.
don't think about this stuff.
Right.
They don't think about sex.
Yep.
And this is
Nope. They're thinking
They should-
about all kinds of things, but that's the last thing that they're thinking about.
I
Exactly.
mean, teaching 8-year-olds about wet dreams, seriously?
Yeah. And that it only happens to
Yeah.
boys. That only happen, like, seriously? I'm like, wow. This happens to
That doesn't really happen until they get in their teenage years.
Exactly.
Yes.
Why
Exactly.
a 7-year-old? Why an 8-year-old? Are you kidding me?
Yep.
I hate that they refer to it as people with a penis or people with a uterus.
Yep. And it says ovulation
It's
and
sickening, yeah.
ovulation and menstruation was the only change said to occur in people with a uterus and ovaries. That's women.
That's women.
Exactly.
Yep.
My gosh. Yeah, teachers out there, if you're teaching this shit, to be honest with you, I'm gonna let you know right off the bat, you're grooming. You are grooming. And if you
Yep,
you say, I didn't know, blah, blah, blah. No, you did know. You do know.
Kids don't need to learn about sexual
Agreed
violence
completely.
when they're that age.
Yeah.
They don't need to learn about STDs when they're that age. They shouldn't be discussing
Right.
sex in any way. If you want to do anything, boys have a penis, girls have a vagina. Girls can
Yep.
get pregnant, boys can't. Boom, done. There's your sex ed.
And if you guys need a refresher,
And
go
of it.
watch that. Yep. And if you guys need a refresher, go watch that Arnold Schwarzenegger movie. What's that?
Oh yeah, kindergarten cop.
There you go. Thank you.
Yes.
Yeah, go watch that.
Yes. It's as
Pretty
simple as that.
Yeah.
Cut and dry.
Yep.
Yep.
Birth givers.
Exactly. And it says once
Oh,
students
that-
are
that
done
is
feeling
infuriating.
Yep.
it should be to us normal men and women. It should be. It should be. And I say normal
Yeah.
because I would never I would actually pack my bags and say, you know what, I'm done with teaching. I'm done. You can't make me teach this crap.
And
I'm
teachers
sorry.
are actually leaving in droves.
Oh, they are?
Oh yeah, there are a lot of teachers
Sick.
leaving. They're sick of it. And not only are they sick
Yep.
of the curriculum, but I think they're sick of the attitudes of the children. Because have you seen teenagers these days?
They're worse than us.
Yes.
No, worse when we were. I'm sorry.
They are an absolute nightmare.
Did you,
Yeah.
hey,
I
did
have
y'all
one.
see where it was said on? I was on a TikTok that a kid came home with a school assignment to do it in her bathtub with a picture of her in the bathtub. Are you kidding me? Who would send their child home with that type of an assignment? We're talking about a 9-year-old kid.
Yeah.
That's
I mean, come on.
Hey, I heard about that.
Yes.
That's grooming.
Yep.
Yes.
Like I'm done mincing words or like trying to be nice about it. You ask a 9-year-old to, you ask any student to do that, and you're grooming them.
Yep.
Tiptoeing around the truth.
Yep. But guys out there, audience, this if YouTube cuts us off, go to Liberty or Death podcast on Rumble. I'm on Rumble too. So just in case they kick us off because of this, because it's gonna get juicier. Like you guys are gonna find out a lot of stuff right now. So okay, so it says I'm gonna finish this last thing up. It says once students are done filling in the columns, the curriculum says teachers should then debrief with students about the 3 lists that were created, being sure to point out to students that puberty is very similar for people of all genders. Wow. Wow. There's only 2. There's only 2.
Yeah. All you're talking about when you say all, it's like there's multiples.
Exactly.
There's 2.
Yep.
It's very simple. XX or XY. That's it.
Yep. And it's and also, you know, I said this before I went live. Before we went live. Yeah, I'm not gonna let it go. I'm sorry. I thought it was anyway. So, if God forbid something happens to you, if you know if you get in a car accident or get sick, the doctors need to know what to treat you. I think I heard of I don't know if you guys heard of Steven Crowder, right? You guys know Steven Crowder?
Mm-hmm.
Yes. So he did an interview with somebody. He was out there asking, you know, blah 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 about, you know, if basically all in a nutshell, the same thing I'm saying is that when somebody goes to a doctor and they stick to these pronouns, or they stick to, well, I you know, I feel like a woman kind of thing, you know what I'm saying, but I'm a male, you know, how the doctors are supposed to treat that, or vice versa. How are they supposed to treat it?
Look at the biology. Yeah.
Yeah. I mean, it's getting worse. I mean, because also too, it's getting to the point to where when I did my research on this, they were saying that there's some places, people that are not even putting the genders in on the birth certificates.
Or they're calling them babies.
Yes.
They're calling them what?
Babies. THEYIES.
Wow.
Because they're not going to refer to their newborn baby as a boy or a girl. They're going to just right off the bat start assigning them the they them pronoun, and they are calling them babies.
Wow.
Yeah.
The kid literally can't open his eyes yet.
Yep.
And they're deciding, regardless of the fact that that child might have a penis or a vagina, that it's a they.
Yep. Exactly.
And hospitals are going along with it. Teachers, doctors and nurses are affirming this. And that's just sick. I don't trust medical doctors anymore. I won't go.
Yeah.
And that's coming soon. It's out there. There are definitions that we're going to hear throughout the broadcast. So it says gender affirming. So we're going to start with gender affirming. It refers to any combination of social, legal, and medical measures that help people feel, remember that word, feel happy, healthy, and safe in their gender. The second one, which I didn't know about until, you know, this last year when I heard about this, I didn't know it was a thing. So it's called gender dysphoria, a sense of misalignment or dissatisfaction with your gender. It's a form of body dysmorphia. A sense. Might as well say feelings. And another one is called gender euphoria. Here we go with the word again. Feelings of alignment or joy about your gender identity or expression. Finding what aspects gender feel good or make you happy can be an important part of your transition. Feelings. Nothing more than feelings. I mean, seriously, wow.
You know, just because
crazy
someone feels good wearing makeup or do it, like if a boy or a man feels good wearing makeup or dressing as a woman, that doesn't mean he is a woman.
Right.
And you can still do all of those things, but you need to own the fact,
absolutely,
facts over feelings.
Yes.
That you are biologically born a man. It doesn't mean that you can't.
Correct.
And you can't dress in drag. That does, and I'm not saying that at all. If you want to dress in drag, go ahead. Fine. Have a good time. Leave the kids alone. If my kid wants to put on makeup and do his hair, fine. But he has to recognize that he is biologically a boy, and under no circumstance can he he can't change his DNA. He can't change how God made him.
Right.
That can never be changed.
That's right.
A lot of these kids are being told over and over again that how they were born was wrong. And you want to talk, you know, it talks about body dysmorphia. And body dysmorphia is literally when you look in the mirror, what you see is not a reality.
Right.
Like for people who have it, if they look in the mirror, oftentimes they will see obesity and they could weigh. And it's the weirdest thing because in your logical brain, and I know because I've struggled with body dysmorphia, in my logical brain, I know I wear a size 2 or I wear a size 4. But when I look in the mirror, I see something completely different. But it's not fact. It's not real.
So I have a question to that, Bunny. Now, did you feel it? Did you feel like that growing up while you were a teenager, or did you still feel like that, or as an adult? I don't know if it's, or you know.
You know, I'm trying to remember when that started. I don't think it was when I was a teenager. Like I remember always feeling self-conscious about my thighs, my legs, because I played tennis competitively and I had really muscular legs. And then I would see all these other girls around me and they all were very thin or whatever. And I thought there was something wrong. Like, why do I have, and I didn't really attribute it to the fact that I had been playing tennis since I was 3 years old and I was very competitive and I was good at it.
Right.
And I needed muscle because all of my strength and my hit came from my legs, you know?
Right.
As I've gotten healthier in body and mind. And now, you know, when I look at myself, I'm like, okay, this is who I am and I'm good with it. And I'm comfortable with it. But I remember thinking, even when I weighed like 105 pounds and I'm in like a size 0, I would still look in the mirror and see something completely different. And it's that it's that divide where facts are not feelings.
Right.
I might feel that way. And for some reason in my brain, I might do that. But I also logically know that that is not true. And it can't be true. Because if I was as big as I think I see myself as, I would not be wearing a size, 0 or 2. And that's just a fact.
Exactly right.
And it's like they are trying to just erase logic and facts and replacing it with feelings. And I'm sorry, but feelings are not fact. They might be true to you, but it doesn't mean it's true to everybody else.
Yeah. And the reason why I asked that question is the reason why I asked that question was because I could kind of, remember going, vividly going through puberty. You know what I'm saying? It was like, everybody goes through it, like, male or female goes through it like at a certain age or whatever the case is. But some people, growing up in school, they hit a certain height, they got muscles, or they got their goatee in already. You know what I'm saying?
Yeah.
And then you as a person, you're like, that hasn't even developed a full stash or Fu Manchu, whatever they call it, back in the days. I mean, you're like, damn, I wish you know what I'm saying? But now it's like, oh, sure, go right ahead. You could be that person right there. You know what I'm saying? They're so quick. It piggybacks off of what you said. They're just so quick. Parents, you can change all this by taking your kid to the nearest doctor, and they'll get confirmed, and voila, there you go.
We live in a society that is full with instant gratification.
Yeah.
And you get a certain feeling and you want it to instantly be acknowledged and dealt with.
Exactly.
And so one day you wake up and you're like,
But
go ahead.
I was just going to say, but when you say that, but these are talking about kids. So when is it okay? Because they're going to change their mind again,
Exactly.
2 hours into that day. So, I mean, how are we going to discuss all this and allow our kids to change their mind in all the process of all this? But we as parents should not be pushing this onto our children, because it seems like it is the parents that is pushing our children to do the gender or the puberty blockers. We as parents are supposed to be setting that example and leading them and helping them grow.
Yep.
I just don't understand why this is such an issue.
There was like this influx of parenting advice that was, you have to acknowledge and validate how your kids are feeling for them to grow up to be healthy, well-adjusted, blah, blah, blah. I mean, we started with the participation trophies. You could completely suck at your sport, but you still get a trophy. My father, my kids' soccer team, they sucked, and they still gave them a trophy. And my dad took it and threw it away. He's like, he's not getting that. Team came in last place. Why are we rewarding these kids? And the thing, like, you don't want to hurt their feelings, you know? And you don't have to be mean about it. You don't have to be rude about it, but you cannot entertain these lofty, I mean, I want to be a unicorn. Well, hun, you can't be a unicorn. It's not real. But I feel like one. Okay, well, go play pretend for a little bit and come and tell me how you feel tomorrow. Well, I'm a giraffe.
Right.
I mean, it's a fantasy. It is a fantasy.
Right.
And these parents, they worry so much about being their kid's best friend as opposed to being their parent. Uh-oh.
Exactly.
Okay, there he is. It's not our jobs to be our kids' friends. That's not our jobs. Our job is to raise healthy, well-adjusted, good people. But how are you going to do that when we're turning them into little, like, maladjusted, barely functioning narcissists by completely
That's a good point.
Fantasy they have. And they're disrespectful and rude because they're just given whatever the hell they want. and it's done.
Right.
Like, I've changed how I parent, because for a long time, that's how I was with my kid. And then I saw the outcome, and it was a shit show. It was a nightmare.
Yeah.
He was a nightmare. And it made life very hard. And we're taking it like Archie Bunker, Red Foreman style. And it works for us.
All right.
He's completely turned around.
Yeah, I changed mine too. I had to do the same thing you did. Changed it completely all the way around. I've got two that are grown adults and with my grandkids, and I completely changed it from how I did with them to my now 11-year-old. You have to adjust.
Mm-hmm. I want him to be able to function in the world.
Yep.
And if I just...
And the world's always ever changing.
Yeah.
Yep.
You can't get a tattoo until you're 18. You can't vote. You can't own a firearm. You can't join the military.
Yep.
You can't get married. But chop off your dick, that's fine.
Oh yeah. Or get what's the hysterectomy or what's that other word?
They get a mastectomy. They get a radical mastectomy and a top surgery.
Exactly.
Yeah.
But get that. Yeah, that's fine.
I don't know about you, but
no,
I didn't have boobs until I was 17.
Yes,
there would have been
exactly right. But look at it now. Look at the kids now. The kids nowadays, they're 13 years old and got bigger boobs than I got.
That's right, Twilight.
It's crazy.
Yeah. What's up, Toloff? What's up?
That's my boy.
Oh, that's what's up. It's almost as if it's a new form of Munchausen by proxy. Parents pressuring their kids to come out as another gender just to force puberty blockers onto them. Yep. Correct.
Yep.
Or they just don't want to hurt their kids' feelings. They want to just validate all of their feelings. And I'm sorry, but not all feelings need to be validated.
Correct. Exactly.
No. They change their mind way too much to be worried about that at this age.
Yep. So okay, we're gonna go ahead and get to these puberty blockers here, because obviously that's one thing that we have that's exactly what we have to discuss here. So okay, so here we go with the puberty blockers. Let me find it again. Hold on real quick. All righty. So the Gateway Pundit wrote an article. Doctor that actually pioneered this. The puberty blockers. Let me know if you guys can see it. There you go. You guys can see it now, right?
Not yet.
I can see it.
Okay. All right.
I can't. There we go.
Oh, right. No, I can't.
Yeah, because I took it off. Give me
down now.
Give me a second. All right, here we go. Oh. I'll get it right one day. Maybe when you guys come back on. If and when. So here we go. Can you guys still see it?
Yeah.
No? Okay. Okay, we were wrong. Evidence shows puberty blockers are neither safe nor reversible, says Canadian doctor who helped pioneer puberty blocker drugs. And so her name is Dr. Susan Bradley, and she who helped pioneer gender affirming care in Canada. Well, you guys say, well, that's Canada. Well, it also pertains to the United States too. That because they're not only doing this in Canada and the United States, they're also doing this in Europe too, in the UK, also doing it in Britain too. So she basically founded a child and adolescent gender identity clinic in Toronto, Canada in 1975, beginning to issue puberty blockers to children around the early 2000s. Wow, I didn't even know that was such a thing. Wow. And she states, we were wrong. They are not reversible as we always thought, and they have longer-term effects on kids' growth and development, including making them sterile and quite a number of things affecting their bone growth. Remember all this, guys, because she's exact. Just remember that. So anyway, I wanted to dig a lot further. So here we go. Um, she said, despite the recent push to affirm children's gender identity by use of puberty blockers, the safety of such drugs is relatively unknown. According to the Deutsche Burger, I'm saying that wrong. I can't say it.
I think
Children's
it's
Hospital.
Dornbecker.
Sorry?
Dornbecker, maybe?
Hey, that sounds good. Okay. And she said, it says here, the U.S. Food and Drug Administration approved puberty blockers in 1993. Remember that. They were originally approved. Yep. I didn't even know that. Wow. I was young. Freaking 93. I was maybe.
Oh my God.
I was 13.
Yeah. Sorry?
No. Yes. Sorry, I forgot how old I was.
Yeah. I mean, yeah, I was like, what, 8th grade or something like that.
Mm-hmm.
I'm sorry, Miss Mel.
I was 20 in 92. So I was 21 in 93. Yeah. Wow.
Yeah. And she said they were originally approved to temporarily stop puberty in children who were going through it too early, which is called precocious puberty. So I decided to do a little digging on here, and here we go. I'm going to hit this real quick, this link. Can you there's a little delay here. Can you guys see it?
Yeah.
Mm-hmm.
Here we go. Awesome. So here you go. This is what they give. This is about puberty blockers. It tells them, puberty is a time when your body develops the ability to have children. It is a process, and it is different for everyone. Different people start puberty at different ages. Okay, which is correct. And it goes on to show that changes for people with ovaries, blah blah blah. And it tells you what are puberty blockers. Puberty blockers are medication to stop changes from the puberty you were born with. These changes make you look physically male or female. For example, they can make your breast, testicles, and penis stop growing larger. Testicles might get smaller. Okay. And it says puberty blockers do not stop all the changes of puberty. For example, they do not help acne or stop armpit hair from growing. They also will not reverse changes that already happened. If you start taking them late in puberty, the earlier changes will not disappear. But the medication can keep further changes from happening. So this is what they use for this is the what they use for puberty blockers. Doctors prescribe 3 main puberty blockers. 2 are given as an injection shot. 1 is an implant that stays in your arm until it is time to replace it. The chart below tells you more about each medication. Lupron is a shot. The doctors, you get at the doctor's office every 3 months. For how long you can do it, I have no clue. It sounds like until you decide to do the transitioning. But they use this too. It's a historyline acetate. It's Serpilin LA Ventus implant. And it's an implant in your arm, and it's a you get it at a gender clinic, and that's every 1 to 2 years. You change that out.
Just like birth control.
Yeah, just about. And it says here, none of the puberty blocker medications are approved by the FDA, Food and Drug Administration, to take for gender dysphoria, but they are still very commonly used to treat it.
Wow.
Yep. It says, what are the possible risks of puberty blockers? The U.S. Food and Drug Administration approved puberty blockers in 1993. They were originally approved to temporarily stop puberty in children who were going through it too early. Researchers have not finished studying how safe puberty blockers are in the long term, so there might be some risks that doctors do not know yet. What does that sound like to you guys? What does that sound like?
Human experimentation.
Thank you.
Yep.
Thank you.
Don't know how safe it is, but yet they're willing to give it to our children.
Wow, that sounds familiar.
Exactly.
Sorry, I want to vape on camera.
Unacceptable.
No, you're good. It is. So here it tells you.
I mean, that's some Mengele stuff right there. That's some Nazi experimentation.
Yep.
Right there.
Yeah.
Yep. Exactly. So here it tells you that the implant, I'm saying it wrong. It's HISTRELIN implant. Histolin, yeah, implant. Okay, the implant, we'll just call it the implant. It's used to treat precocious puberty in both male and female children who are at least 2 years old.
2?
Yeah. I mean, I'm not saying it's not rare, but I haven't heard a 2-year-old going through freaking puberty at 2 years old.
Jesus, Pete, give me a break. Wow.
Have you guys? I mean,
No.
Have you guys heard?
No, absolutely.
Oh, and get this, guys. I'm sorry. Go ahead, Mel.
I'm just going to say that it's just not only sickening, but it is extremely frightening.
Yep. Yep. And it says here that this medicine, the implant, is what it's used for is to treat prostate cancer in men, and treats only the symptoms of prostate cancer, but does not treat the cancer itself. Okay. So it tells you the warnings, of course, blah, blah, blah. Side effects Histolin can cause side effects such as crying spells, anger, aggression, and feeling restless or irritable. So, but here's the Lupron again. You should not be treated with Histolin if you're allergic to Histolin or similar hormonal medications such as, Lupron and there's others. And it says it's to make it safe for you, to make you can't have you need to tell your doctor if you have ever had mental illness or psychosis, a tumor or blood vessels disorder in your brain, or if you take a medicine that can cause seizures, such as an antidepressant.
You see what Torlock said?
No, I didn't.
How can a 2-year-old show long-lasting or intense patterns of gender nonconformity?
Exactly. Makes no freaking sense.
My son couldn't even really talk until he was a little over 2 because he had chronic ear infections.
Yeah.
And he could barely put 2 words together. But he's going to decide he's going to display a consistent pattern of gender nonconformity at 2.
That's the parents. That's the parents right there.
It's completely the parents.
So,
I mean, why would you do that to your child?
Yeah, exactly. So I wonder if Joe Biden is still on him. Oh my God.
Oh God.
Yeah, it's 100% abuse.
Yeah, it is. It is.
Yeah, child abuse through and through.
Mm-hmm.
Yep.
You know, the brain does not fully develop until you are 25 years old.
Correct.
That's
They're
right.
already creating, they're trying to change the laws in, what is it, Maryland, that if you are 25 or under, that you can't be charged with a felony murder because you don't understand the consequences of your behavior, your bad acts. But yet, you can make the decision to cut your penis off when you are under the age of 10 years old.
Right.
So they don't want to hold people, and on children start learning the difference between right and wrong around the age of 2-3 years old.
Yep.
They know at a very
Yep.
young age, if they're taught right, to not
Correct.
commit
Yes.
murder, to not hurt other people. But they
Yep.
might not necessarily they don't understand long-term repercussions
Yep.
for their actions, and that's why they're considered children, and that's why they have juvenile courts and adults. That's why they're separated, and they're looked
Right.
at very differently, because at a juvenile level, at that young, tender age, they can't understand consequences. And yet these adults are giving them the opportunity to make these very long-term, permanent decisions about their body that they have already admitted are irreversible.
Yep.
Yes.
And it doesn't make any sense to me. I mean,
No.
No, it doesn't, and it goes on. Yeah, it doesn't make any sense, because here on the history, it says that it's a tiny implant inserted under the skin on the side of your upper arm, which will probably be like where your bicep or tricep is. Like just like
Right
you said,
here.
like
Just where they would put the birth control.
like a depot
They had
shot.
birth control
Is
is
it
where I
depot?
had mine. Yep.
yeah,
The depot?
like yep, like what did you say, Bunny? IUD, or what? That's what it's called.
No, the IUD goes up the
Oh
cookie.
yeah, there.
Yeah.
But
Gotcha.
the depot it's the depot shot, right? That goes in your arm. Is that what it is?
I
think
had the
so.
Norplant in
Or
92,
Norplant, that's what it is.
and the
It's
Norplant goes right here in your arm
Uh-huh.
underneath the skin
Okay.
And you're putting
on your
yourself at risk.
bicep.
And you have any kind of inanimate, or what is it called? Not inanimate. Foreign object lodged into your body,
Mhm.
you're setting yourself up for
Right.
infection and a whole slew of other things.
Absolutely.
You're weakening your body's immune system.
Yep. You guys want to hear the side effects on the Hysterline?
Yes.
What it says: Hysterline may cause serious side effects. Call your doctor at once if you have bone pain, numbness, or weakness in your legs or feet, painful or difficult urination, blood in your urine, a seizure, increased pressure inside the skull, severe headaches, ringing in your ears, dizziness, nausea, vision problems, pain behind your eyes, or mental problems, crying spells, anger, aggression, feeling restless or irritable.
Holy cow.
Yeah. And the common side effects are constipation, urinary problems, breast swelling, hot flashes, feeling tired, erectile dysfunction, impotence, decreased testicle size. Remember that.
That kind
Or
of sounds like women go through when it's that time of the
Menopause.
yeah, menopause. Thank you. That sounds like menopause. Wow.
exactly. And all these, all the when I did this research, that's what these, like, okay, I don't know if you guys heard of Chloe Cole.
You told me about her.
Yes,
No.
she experienced all this stuff, but she wanted to be a boy. Like, her history is like, if you guys aren't familiar with it, she wanted to be a boy. She grew up as a she was a tomboy, basically, and she wanted to be like the boys. But yeah, she's yeah, that's yeah. Go look her up. Have you heard of her, Mel?
No, I have not. But I'm going to look her up.
Yeah, look her up. It makes you wonder. I'm not gonna lie, I was crying because the heck that she went through. A lot of heck.
Okay.
Okay, so we're going to go and hit on Lupron. Excuse me. So it's called Luprolite side effects, and include atrophy, decreased testicular size, dermatological reaction, edema, gastrointestinal disease, headache, hot flashes, increased lactate.
Wow.
It makes you lactate?
That's what it says. Increased lactate.
You don't lactate unless you have a baby.
Ugh.
Yeah.
That sounds terrible. Did you see what Torlock said? So you have people that already believe they are the wrong gender. They take these medications and have severe mental side effects that cause depression-like symptoms. And then they go out into society and are told they are being genocided.
Yep. Yep. I saw a tweet on Twitter. I was on Twitter one day, and they were talking about something about the puberty blockers, and somebody wrote, he was like, I'm paraphrasing here. He's like, it's weird how all the conservatives are now focusing on children. It's weird. What do you mean it's fucking weird? What do you mean by that? Like he's trying to make conservative, make it a left and right thing. It's not about a left or right thing. It's to a point. Go ahead, Bunny. I'm sorry.
You know, I've said this before, but to me, it's not a left or a right thing. If you aren't for protecting children, then we're not the same.
Exactly. Thank you. I mean,
that's what it boils down to is the kids.
Thank you. And for everybody, this was last they updated the Lupron. The Lupron was last updated on February 5th of 2023. So whatever.
Wait,
go ahead.
What's arthropathy?
I don't know what the heck. What is that? Is that like some kind of?
I don't know. We need Justin to do his Googling definitions for us.
Yeah.
God, what is that? I've never heard of diaphoresis. I've heard of that. I don't know what that means.
Yeah, and it's a respiratory system disorder, abdominal hepatic function test. I think that's got a hepatic. Yeah, wow.
Hepatic.
Just to let you,
serum aspartate aminotransferase.
The hell is that?
What? Like these side effects. What are these side effects? The arthropathy, asthenia,
decreased testicular size.
Well, I think we can. That's pretty self-explanatory.
Yeah, yeah. I mean, me as a male, you know, I'm like, holy shit, no.
Like, okay, serum. I think that has to do with the blood.
Yes.
Yeah.
Alkaline phosphatase. Yeah. Okay. When cells that contain AST are damaged, they release the AST into your blood. The AST blood test measures the amount of AST in your blood. I mean, your body wants to be at homeostasis.
Mm-hmm.
And it uses, you know, like your pancreas and the other hormone secreting organs for your body to create homeostasis.
Right.
And to self-regulate.
Yep.
And you can self-regulate using food and supplements and vitamins and things like that. And then you introduce these foreign bodies into a developing system where hormones are already all over the place, and
Yep.
you're sending your body into fight or flight mode.
Thank you. Thank you.
Right.
And I'm not talking like the fight or flight, like you've been attacked or
Right.
you've had an accident. Like your system has, like the vagus nerve and everything, and you're in fight or flight, and your body is starting to fight itself.
Yep.
It breaks down your immune system. And a lot of these, I'm surprised it hasn't even talked about the potential for cancer, like the synthetic hormones that they used to give to
Yes.
women
Yep.
and stuff, like in menopause, and it ends up turning out that it causes cancer.
Yep.
And like the hormone replacement therapy.
Yep.
Yep.
So of course they don't know the long-term side effects because they've just really started using this. But if that's what happened to
Why on kids?
yeah,
Kids.
why on kids?
Oh,
God,
and also, Bunny, too. Yeah, and that's the thing. Jordan Peterson, who I think people may know out there who Jordan Peterson is.
Mhm.
He's just saying, let these kids go to puberty, leave them alone. Like,
amen.
The studies have found that the studies that they're whatever he knows something or whatever. His doctor that he looks up or was friends with, he was saying all they got to do is let these kids go through puberty, man, because everything, their body's going through changes in puberty, their attitude, their hormones, et cetera, just let them go through puberty.
Yeah,
Emotions.
eugenic.
Yes.
Experiment on a generation to force severe health issues to cause population drop.
Yep, and it says the less common side effects in adults here are fast or irregular heartbeat, but the rare side effects are bone, muscle, or joint pain, chest tightness, fatigue, fast or irregular beating, numbness or tingling of the hands or feet, puffiness or swelling of the eyelids or around the eyes, skin rash or itching, sudden severe decrease in blood pressure and collapse, trouble breathing. I'm just letting the audience know out there, we're not doctors. We're just normal, average
people with common sense.
Exactly. Thank you.
And parents.
And parents.
Exactly. Yep. Like, what the heck? They got you got the for males only, adults. More common is arm, back, or jaw pain, bloody or cloudy of urine, blurred vision. I mean, these are all. This is for male adults. It doesn't say anything about kids here.
If you start early on children in their development, you can create new DNA mutations and at the same time slow their development to ensure they don't live until 100 like Biden and Pelosi.
Oh,
it's funny because it's true.
Yeah,
yes,
it is.
I agree. Yes.
Yeah, so nausea, nervousness, pain in the arms or legs, pain in joints, pale skin, pounding in the ears, like all this stuff, like, and I'm like, gosh, and it says rare is pain in the groin or legs,
What does that mean? Incidents not known. Altered mental.
I have no clue.
There's no statistics on it.
Yeah.
And yet that's what they're displaying.
Exactly.
Oh boy, not to go too far down the rabbit hole, but I always like when he does that.
Well, I like going down the rabbit hole.
Look at all of those the psychological side effects. Thoughts or attempts at killing yourself.
Where do you? Oh yeah! Wow! Yeah.
Okay.
Wow.
I mean, hormonal dysregulation can cause suicidal ideations or suicidal attempts.
Yeah. But wait, buddy, and Mel, it but damn, what I was gonna say. Hold on, I lost my train of thought. But it doesn't cause them to commit suicide, though.
No.
But that's what they say. That you know what I'm saying. That's what they're saying.
Yes, it does.
And it says for female only adults, quote in parentheses, anxiety, deepen in voice, increased hair growth, mental depression, mood swings. Oh yeah, mood changes.
Imagine a government being able to determine the max age of their population so they can churn out workers when needed and expend them at a certain age. By experimenting on children, you gain the most scientific medical knowledge on side effects and long-term effects on the human body.
God.
And now we're getting to the children. This is for children more common. Body aches or pains, chest tightness, chills, cough producing mucus, difficulty in breathing, air congestion, fever, headache, loss of voice, muscle aches, noisy breathing, pain or redness at the injection site, runny or stuffy nose, sneezing, sore throat, unusual tiredness or weakness.
So the flu.
Pretty much.
Yeah.
They're saying that's the side effects. It sounds like the flu.
Exactly.
Or COVID.
That's a good one.
Yeah. Oh
That is a
boy.
good
Yeah.
one. Yeah.
Oh.
Wow.
Or early stages of HIV.
Yeah.
Oh my God.
Yep. For females only in children, expected in the first few weeks, it's vaginal bleeding, white vaginal discharge, continuing.
That do not need medical attention?
Some side
effect may occur that usually do not need medical attention. Any side effect,
yeah,
you seek medical attention.
Yeah,
absolutely.
Oh, I just have severe headaches and I'm bleeding out of my orifices. It's fine. I'll just get a tampon and some tissues and just.
Yeah. See how it only pertains to females? Oh my God.
Yeah.
Damn. Oh wow. That's crazy. Yeah, so it goes on and on, man. It goes on and on. Like,
if they continue or are bothersome.
What are you talking about?
Is that go back up for a second? Just a little bit. Check with your healthcare professional if any of the following side effects continue or are bothersome, or if you have questions about them. But then right above it says most side effects don't need medical attention. I don't
exactly.
Exactly. If these kids are having like hot flashes, you're having hot flashes. If you're bleeding, bruising, burning, itching, pain, redness, or swelling at the injection site, decreased interest in sexual
They shouldn't be even sexual. Oh, Jesus. These are kids.
Yeah, and it has for adults too. They have bleeding, bruising, burning, itching, pain, redness, or swelling at the injection site. Decreased interest in sexual intercourse.
You see what Tarlock just said? Every single drug ad on TV tells you if you experience a side effect, you should contact your doctor.
Mm-hmm.
Yeah,
that's true.
Exactly. Yeah, wow, it's crazy, man. I mean, the list goes on and on. It goes on and on.
So basically what they're saying is we're just going to give you these drugs and you just need to go and suck it up.
Correct.
And you'll be fine.
Yep. That's what basically they're saying.
Constipated, bleeding, and puffy everywhere.
Yep. And you're having mucus coming out of your nose left and right,
And you've got an altered mental state.
Yep.
Yeah, it sounds like a good time. Let's definitely give this to kids.
Yeah, exactly. And Yeah, it's crazy, man. Oh, and
I
guess
think
what?
these
The
doctors doing it too.
you guys want to know what's next? Remember all that
Yes.
medication? You remember this medication that we're discussing, the Lupron and the Hysterlin? It's used for
Yeah.
chemical castration. Chemical castration.
Oh yeah.
So this is what we give the pedophiles.
Correct.
And we're thinking about our kids.
And
Yes.
they're
Wow.
giving it to children. So the
Yep.
same thing that they're using on pedophiles. Let's just give it to the kids.
Yep.
And call it a day.
But yeah. It says here chemical castration.
Their feelings.
Yep. It says here chemical castration, sometimes called medical castration, refers to the use of chemicals or drugs to stop sex hormone production. While many people know about this process, as a way to stop sex offenders, medical castration is used as a treatment for tumors that feed on sex hormones. The treatment, also called hormone therapy, may be used to treat breast cancer and prostate cancer. Yeah. Yep.
Unreal.
It is. Yep.
That's so scary. I mean,
yep. It is scary. And boom, there you go. Here you go. This is what I'm saying. Remember the Lupron and the Hysterlin. Here you go. That proves that this is what they're using for hormone therapy for children. But you know, that's and it says here the medication stops the pituitary glands. That's what the Hysterine and the Lupron stops. It stops the pituitary glands from releasing luteinizing hormones that tells the testicles to make testosterone. First, however, they cause a high level of hormones that eventually ignore. At that point, you may have what's called a testosterone flare. You may need to have another type of medication. But yeah, this is what they use to.
So they're giving out these drugs, but they're not doing the actual research to see if the class of sexual offenders known as paraphiliacs can be treated with an anti-androgenic drug called medroxyprogesterone acetate, which chemically castrates the offenders. That MPA is a common progestin used in feminizing GAH therapy. Despite its widespread use among trans women, MPA has not been investigated in the context of transgender care. And yet here they are giving it to kids.
Yep, exactly. Exactly.
I'm sorry, but that's just flat out abuse. That's abuse to our children.
That's abuse. If you know all of these, if you as a parent know all this, and you do your research and you know all this, and you're still willing to give your kid that transition, that is child abuse. My opinion on that.
And neglect.
Yes. CPS has taken children away from parents for a lot less. That's another story, but you know what I'm saying?
Yes, it is. It is a story in itself.
Yep.
Wow.
And yeah. So yeah, this medicine, the Lupron and this stuff, it's not only to treat breast cancer and prostate cancer, it's to chemically castrate sex offenders.
That's a hard one to swallow right there.
Yeah. But it says here the rescue benefits. What are the benefits of chemical castration? It's not permanent. It's been effective in managing certain types of cancers. What do you mean it's not permanent? I'm sorry.
What?
Yeah. What do you mean it's not
They
permanent?
just said it was.
Exactly.
It is.
That doctor said it was irreversible.
Yeah.
And here they are saying that it's not permanent. That is a brain buster right there.
Yeah. It said there are side effects to medication for hormone therapy for both prostate and breast cancer therapy. Each medicine has its own side effect profile and general long term. Every research that the research that I have done for these 3 weeks, they've been pointing to osteoporosis and heart disease. They've all been pointing to that.
But we want to give it to our kids.
Yes, thank you.
Jesus.
And all of them also said like Chloe Cole and there's another detransitioner. They're called detransitioners. Chloe Cole and I think her name is Shifter. His name, I'm sorry. She goes by Shapeshifter, I think. I believe. Don't quote me on that. But he says that he doesn't have no sexual desire whatsoever. He's sterile. He's got their bone density has no bone density whatsoever. Hardly. He has osteoporosis.
So his quality of life is next to nothing.
Screwed. Yes. Exactly. And if you guys don't believe me, you guys, the audience out there, the Lupron is FDA approved. It says here, FDA approved, yes. The Lupron is FDA, but not what it's meant for with children. It's not, or any healthy adult or children. It's not used for that. It's used for breast and prostate cancer.
Well, and you know what? That's how they get away with it, because there are a lot of drugs out there that are meant for one thing, but
Yes.
since they've passed
Right.
FDA approval, and then they're like, oh, well, we've seen effectiveness in this, or that's been an outcome, so we're just going to off-label use it for that.
Right.
Yeah.
Well, you see it all the time with medications that works for one thing, but you see weight loss. So we're just going to use that for weight loss.
Yep.
I mean, that's not what it's designed for.
What's that diabetes medication that was that Premarin? Is that what it? No, it's not Premarin. All these like celebrities and Hollywood people are using, there's some diabetes medication, and they're using it for like rapid weight loss.
Oh, I don't know.
Thought it started with an A.
Does it? Yeah, I can't remember.
Aprin or what? I don't know. I don't remember.
Crap, I can't remember.
I can't remember it. I almost swear it starts with an A, but
yeah. So yeah, it's used in cancer, right? That the Lupron, but if you guys are still doubtful out there, let's look at slow down, Josh. Let's look at it. Let's hear from a doctor's perspective.
Ozempic.
Ozempic.
That's the drug.
That sounds familiar.
Yeah, that's the diabetes medication that people are using for weight loss.
mm-hmm.
So this is a doctor. This is off a YouTube video from the Heritage of, I forgot what it's called.
Heritage Foundation.
Thank you. Yes, and I think I lost it here. Give me a second. How do I go back?
I see it.
Oh, shoot. I lost it. Hold on. I might have to come back here. Remove. Stop screen share. Present. Yeah, can you control time? I don't know. That I'm Rumble. I'm on. Yeah. I'm here on Rumble too. So I'm looking at the comments. Minuteman UK is like no drugs for children. Yes. Shout out to everybody that's watching from Rumble. Here you go, Heritage Foundation. Oh, come on. Please. Please, please, please. Why did I do that? Like, seriously, why did I do that? Should be able to go back, right? Damn it. Yeah, that's not gonna work. Yeah. So yeah, I mean, you know, they give this medicine to kids, and then at that point they're like, oh well, you know, you haven't like, I mean their body is like is basically undeveloped. You know what I'm saying? Underdeveloped, and it's and you know they're like, oh, I might as well just get the sex change. You know what I'm saying? Like at that point, you I mean, you know, at that point you I don't know why, man.
You're
Just
screwed by
weird.
that point.
I mean, you're like, oh, well, screw it now. You know, I mean, I don't my nuts shrank. You know, and stuff like that. I have the, you know, screw it. Might as well just freaking do it. You know what I'm saying? Like, just transition me already. Here you go. I'll have to go back. Oh yeah. So what do you guys think so far?
I think it's an attempt to depopulate,
Absolutely.
and another form of human experimentation, and they're using children.
This
And-
process
And
is
people should be in an uprage.
hypogonadism.
Really.
Exactly.
You know, keep in mind that Fauci is, you know, the HIV doctor, right?
Yep.
And who did that primarily affect?
True.
Yep.
So what if the entire goal is to wipe out the LGBTQ community?
Yep. And not
I mean,
only
think
that.
about it. I mean, seriously.
Yep.
Because hetero men and women are not experiencing this. The only person that I know of that has done this that is hetero is Bruce Caitlyn Jenner.
Yep.
Yes.
Because she is straight, like loves women.
Yep.
And there's a whole rabbit hole with how that got, whatever, we're not gonna go into that. Straight people aren't changing their genders.
I mean, he has even came out and said this is enough. This is enough.
Yep. I think it's targeted
Yep, you're right.
at the gay
I
community.
agree.
I think it's another form
Nobody's
of eugenics.
opening their eyes either.
No.
Well, they want, you know, the Nazis wanted to create the perfect race.
Yep.
I think this is just another form of it. I don't think it's another form. I think it's a continuation of it.
Yep, it is. And so this is the doctor, and I found a video. So this is the doctor explaining everything.
I
So-
think
What's up?
Mengele. Sorry, Torlock just asked a question about who was the first doctor that started transgender care and who or what are they connected to. And I would almost bet that it came from the Nazi doctors.
Yep. Well, of course, because Operation Paperclip. Yep.
Sorry, my son's texting me.
No, you're good. So I'm gonna start the video off, and here we go.
Before you give harmful
Hold on, let me
chemotherapeutics.
go back.
The opposite of allowing kids to grow out of this or helping them with therapists is gender affirmative therapy, and Aileen went through that. But basically, a social transition, puberty blockers, which I'll talk about, cross-sex hormones or opposite-sex hormones, and then surgical modifications. What is all this predicated on? Something called gender identity. This was defined in a court case as a person's core internal sense of their own gender. What's interesting I found in this case is they said that this gender identity is the primary factor in determining a person's sex. This is an ongoing case, and not biology. That's incorrect. Colleagues and myself wrote a letter to our main endocrine society's journal with concerns about this therapy, but also the diagnosis. Let's think about it for a minute. If your child or someone you knew had cancer, would you want a pathology result? Would you want imaging to prove the cancer before you give harmful chemotherapeutics? How about this? How about for the so-called transgender child, the gender identity? Can you find it in a blood test? Can you do testings of genetics? Or can you do a brain image and find the gender identity in there? You cannot. There is no objective test to diagnose this. Yet we're giving very harmful therapies on the basis of no objective diagnosis. This might seem obvious if you can see the slide. There are only two sexes. Certain science publications want to make you think there's more or that it's a spectrum. You can prove this to yourself through a thought experiment. Start with yourself as a fertilized ovum and work your way backwards. You'll find a sperm coming from a male and an egg coming from a female. And this is true of 100% of cases, now and forever in the past and forevermore. Mm-hmm. Sex is identified at birth. Nobody assigns it. Doctors don't arbitrarily assign this person to be a boy and this person to be a girl. And we all know how to identify it. I would say ask someone's grandmother who doesn't read these science periodicals, and they'll tell you exactly how to identify boys from girls. Now, we divide sexual development into stages we call Tanner stages. And you see at the top there, Tanner stage 1, the male is on the left, female on the right. 1 is undeveloped before puberty. 5 is full adult development. 2 is the beginnings of puberty. So a pediatrician could recognize this through beginnings of pubic hair. As you can see, beginning to lengthen the penis, testicles, breast development in females. Later on, around stage 4 is where fertility is established. First period in females, sperm development, usually 4, sometimes 3. But those are important times to keep in mind. What governs this whole system is the endocrine system. There's a small gland that's at the top there called the pituitary gland, hangs off the brain, produces hormones, signaling hormones. You can see LH, FSH. These act on the gonads. So in the male, LH will act on the testicle to produce testosterone, you can see illustrated there. And in the female, LH will act on the ovaries to make estrogen. And it's these hormones which take the person through the stages of development and then are available in adulthood. Now, there are medical conditions where this process is interrupted. We call it hypogonadotropic hypogonadism. This is something an endocrinologist would diagnose and treat. There are also hormones which can cause this to happen. Medications like Lupron you may have heard of. This is used for prostate cancer. It works in this way to stop the pituitary from making this LH and lowering testosterone and preventing growth and spread of prostate cancer. It's also used in early puberty. There's something called precocious puberty. This might start at, say, at age 4. And so doctors can use this type of medication to delay it to a more appropriate age, like age 10. What about using this medication for stopping normal puberty, say at 12 or 8? This is an off-label, untested, experimental use. It hasn't been through any FDA approval process. It's what I would call a chemical conversion therapy. You can see here illustrated our endocrine society is recommending for these kids to stop puberty at Tanner stage 2, which is just the very beginnings of puberty. And you can see they will not proceed through the other steps of puberty. This is what leads to infertility because they don't establish fertility. Other problems of sexual dysfunction on the I Am Jazz show, Jazz says, I don't have any sexual sensation. I don't have any orgasm.
That's true.
This is because puberty was stopped at this stage and never allowed to go forward. Okay, how young of an age are we talking about for puberty blockers? You can listen here to Ilana Scherer of UCSF Pediatrics.
As far as starting blockers, generally blockers are started at the first signs of puberty. It often can start like as early as like 8 at times, or 9. And so those are kids that are going to be like in 3rd or 4th grade.
So in case you didn't hear, 8 or 9 years old, 3rd or 4th grade, and think of what you were doing or your kids at age 8, maybe building a snowman, maybe talking to snowmen, maybe thinking you were a cat or a fairy, something like that. Do we really know that the girl thinks he's a boy? Is really that the case? Is this the appropriate time to be starting these medications? More side effects. I went through some of them. You're going to disrupt the normal brain development that's happening with the sex-based hormones. It actually disrupts normal bone development because the sex hormones are important. So osteoporosis is a future risk. There are also neuropsychological effects. You can go yourself and look up the side effects of, say, Lupron. You'll see emotional lability, nervousness, anxiety, delusions. It even says monitor for development of worsening of psychiatric symptoms. Used with cautions in patients with a history of psychiatric illness. I've already said many of these adolescents have neuropsychiatric conditions. Professor Michael Biggs at Oxford, through Freedom of Information Act, found out what was going on in their Tavistock clinic. Children actually reported greater self-harm with this medication. Girls exhibited more behavioral and emotional problems, greater dissatisfaction with their bodies. Now you would think, if you have these side effects of these medications, wouldn't you want to stop? Well, eventually they do stop, but they found that the limited studies they have, 100% end up going on, up to 100% going on to cross-sex hormones, which is the next. So cross-sex hormones or opposite-sex hormones, which are really wrong sex hormones, will be the next stage. So if a female would be given testosterone, just to give you an idea how high these doses are, normal adult female will have a certain amount of testosterone, say in the range of 10 to 50. Medical conditions could bring this up to 150. Tumors may make this as high as 1,000. They're recommending to get these levels in the 300 to 1,000 range. This is some 10 to 40 times higher than the normal range. And are there side effects from this? Of course there are. Both sexes have shown increased risk of myocardial infarction and death due to cardiovascular disease. That's males taking this estrogen, females taking testosterone. With the male, 5 times increased risk of deadly blood clots, 2 times increased risk of stroke. Females also been shown with liver dysfunction, hypertension, potential for cancer of the ovaries or breast. I want to make this clear. There's no FDA approval for either of these medications for this use. And even at the UCSF pediatric site, it explains there, that's highlighted, that there is no FDA approval for this, but they're looking to get it through doing experiments. Here's another example. So the next stage is surgical conversion therapy. This is a female who had a mastectomy, and you can see the drain tubes there. People have said, you know, isn't this a male, Dr. Laidlaw? And we're looking at the male pattern abdominal hair and the 5 o'clock shadow. These are the direct results of high-dose testosterone. This is from a publication. Dr. Johanna Olson-Kennedy is doing a 5-year, $5.7 million got a grant for research to study these hormones. One of the publications shows mastectomies done on girls. And you can see there is a couple of 13-year-old girls having mastectomies of completely healthy breasts, 14.
Gosh.
There's 5 and so forth. Now, can a person of 13 or 14
Can you pause it
consent?
for a second?
Do they know?
Yes,
if
yes,
really
you are
that
right.
they
Give
want
me one
breasts
second.
Later on in life, can they get them back again? Let's hear what Dr.
Yeah, go ahead.
You remember when everyone was all in an uproar about genital mutilation going on in Africa and the Middle East and things like that?
Yep.
Was that
Where's
a couple years ago?
Yeah, where's the fucking outrage now?
Exactly.
I agree.
Because this is far worse.
Yeah.
Yep.
And he said it twice. This is not FDA approved. This is not FDA. Well, then why in the flying hell are we even attempting this?
And this, yeah, you're right. And this video was 4 years ago. 4 years ago. 4 years ago. And it's still relevant today. It's still relevant.
It shouldn't even be.
Correct.
It's infuriating.
Very.
Sorry, I didn't mean to interrupt. It's just
No, you're good.
this fake outrage, this virtue signaling stuff.
Yes.
Like, let's go ahead and insult other countries,
Yep.
but let's just mutilate our own children.
And there's and what kills me is that parents are believing this ish, man. If it took me maybe like I would say, I'm gonna be honest with you, 2 days to connect the dots on this shit. And I'm like, I'm pissed off. I'm mad. I am very fucking irritated because you know what? I mean, I'm sorry, if we live to see this long, my grandkids grow up. I mean, my grandkids, I gotta protect I'm thinking about my grandkids. You know, I'm thinking about my kids. You know,
Absolutely.
I mean, come on.
Yes.
Yeah, this is crazy, man. I am
I think
pissed.
you were a little bit further down.
Sorry.
I think
I'm
you were a
pissed
little
too.
bit further. See where?
Oh, you talking about the minutes?
Yeah,
Oh, okay.
I
Wait a
think.
second.
See, like where the lighter
Yeah.
white button is, or
Right.
the tab
Yeah,
thing. I think that's where we were.
All right.
Hormones will be the next stage. So if a female would be given testosterone, just to give you an idea how high these doses are, normal adult female will have a certain amount of testosterone, say in the range of 10 to 50. Medical conditions can bring this up to 150. Tumors may make this as high as 1,000. They're recommending to get these levels in the 300 to 1,000 range. This is some 10 to 40 times higher than the normal range. And are there side effects from this? Of course there are. Both sexes have shown increased risk of myocardial infarction, death due to cardiovascular disease. That's males taking this estrogen, females taking testosterone. With the male, 5 times increased risk of deadly blood clots, 2 times increased risk of stroke. Females also been shown with liver dysfunction, hypertension, potential for cancer of the ovaries or breast. I want to make this clear. There's no FDA approval for either of these medications for this use. And even at the UCSF pediatric site, it explains there, that's highlighted, that there is no FDA approval for this, but they're looking to get it through doing experiments. Here's another example. So the next stage is surgical conversion therapy. This is a female who had a mastectomy, and you can see the drain tubes there. People have said, you know, isn't this a male, Dr. Laidlaw? And I'm looking at the male pattern abdominal hair and the 5 o'clock shadow. These are the direct results of high-dose testosterone. This is from a publication. Dr. Johanna Olson Kennedy is doing a 5-year, $5.7 million got a grant for research to study these hormones. One of the publications shows mastectomies done on girls. And you can see there is a couple of 13-year-old girls having mastectomies of completely healthy breasts, 14, there's 5, and so forth. Now, can a person of 13 or 14 consent? Do they know what really that they want breasts later on in life? Can they get them back again? Let's hear what Dr. Olson Kennedy has to say about that.
So what we do know is that adolescents actually have the capacity to make a reasoned, logical decision. And here's the other thing about chest surgery. If you want breasts at a later point in your life, you can go and get them.
If you caught that, she said, if you want breasts later in life, you can just go and get them. Is that correct? Can you just get a new organ, mail order it, have surgeons put it in? You cannot. Just another, so for Jazz, and the question, well, why were this complications of surgeries that Elaine talked about? Well, if you stop puberty at Tanner stage 2, as you can see, the penis length is very small, so they can't use the full length of an adult penis to make the pseudovagina. On the right, it just shows a section of colon or large intestine being put into place to make the fall. So that's why this is happening as a direct result of puberty blockers. So what's the bottom line on this child adolescent affirmative therapy? We don't know long-term outcomes. I've told you already some short-term problems, but it hasn't been tested from childhood forward. Medications are being used off-label without proper FDA risk assessment profile. The quality of evidence, if you look at Endocrine Society's own guidelines on this for children and adolescents, it says right in there, it's low to very low quality evidence. This whole thing is an experiment on children. We're ignoring the voices of desisters and people who have come out of this and recognize their sex. And the NIH is allowing unethical research to be conducted on children and adolescents.
Oh, no. No, they're not.
And so myself and colleagues
Freaking A.
used Freedom of Information Act to get more
No
information
sarcasm.
about this research study, Johanna Olson Kennedy at Children's Hospital Los Angeles, and found that in 2017, they actually lowered the minimum age for cross-sex, wrong-sex hormones. It was 13. They lowered it down to 8 years old.
Wow.
So imagine giving 8-year-old girls
Oh, come
testosterone.
on.
They're in 3rd or 4th grade.
Yep.
This is unbelievable,
Jesus.
but this is going on, and you can see where I pulled the reference. Now, the question is, how young is too young? Before they were giving cross-sex hormones at 16, and then it was 12. Now it's 8. And I look at this as an endocrinologist and say, you know, there is another way to stop puberty if you don't want to use these medications. Just remove the testicles and the ovaries. You could do it at age 4, for example. Remove the gonads. How could a 4-year-old possibly consent to this? And I was accused of you know, the slippery slope when I said that. But we're already down the slope.
Right.
We're already down the slope. And who's going to stop this? Who will speak up for these children? And all of us need to speak up. Thank you.
Yep.
Parents should do it too.
Yep.
What he said.
Yes.
Exactly.
Damn.
Exactly.
8.
I can't
Yeah.
believe that.
Yep.
And these doctors
Third-
are allowing it. Why can't the doctors stand up? Because it's all about that money.
Exactly. Yep.
Pisses me
And-
off.
Yeah, and that's what the interview of Chloe Cole said when she went to get her top surgery. She only got her top surgery done. She felt as if once again I'm paraphrasing it. She felt as if this was being glorified, and you know, yeah, because she was in a room of people that kids that were going to get transitioned, and she just says they were like 12 years old and younger. You know what I'm saying?
Oh,
Who were getting surgery, but she felt like as if it was like a money grab. You know what I'm saying? Because they would glorify it. You know, they have pictures on the walls of people just being happy and stuff, and she's like, that's not the case. That's not true in my case. That's
Right.
not true.
mm.
Yeah. So the media is the liberal media is spinning this to be if your kids to speed it up things up they're saying, oh, these kids are like basically parents, if you don't get your kids what they want, they're gonna unalive themselves. That's not true.
No.
That's not true. Statistics here for the suicidal disparities on 2019. Once again, this is what 4 years ago, and the suicide rate is uncanny.
It kind of goes back to parents need to be parents and quit trying to be a best friend.
Exactly. That's what it goes down to. That's what it boils down to. Why can't I find it?
Like at this point in my parenting life,
Yeah.
I don't care about, hurting his feelings when it comes to lofty, crazy ideas.
Yeah.
I care about keeping him safe. And keeping him
Exactly.
healthy.
That's right.
Yeah. Okay. Here you go. Exactly. 100% agree. Let me see this. Let me see if I can share it. Where am I at? Oh, bruh. Real quick, we're gonna speed right through this. Yeah, this is just as insane.
I've been sitting here gritting my teeth this whole time, and I've got a massive headache. It just
Oh
pisses
wow.
me off.
Yeah, as it should. You have every right to be pissed off. Hold on. Oh, why can't I find it? Why can't I find it?
You know, the solution for gender dysphoria, if it's a form of body dysmorphia,
Uh,
that can be treated with, you know, cognitive behavioral therapy and dialectical behavioral therapy.
okay, what do you mean by cognitive
Cognitive
therapy?
behavioral therapy is it's a form of therapy that's used to help change your thoughts and how you stop judging your thoughts
Perceived thing.
and looking at your thoughts as not fact.
Uh-huh.
And honestly, I think dialectical behavioral therapy that's a lot to do with like mindfulness and staying in the present and learning how to just observe a thought without judgment.
Right.
And when you practice those things with anybody with any kind of mental health issue, like DBT was initially started to treat people who were suffering from borderline personality disorder. And there isn't a drug that can treat borderline personality disorder like they can with, you know, depression or anxiety. And it teaches you about mindfulness and practicing gratitude, and to just, if you have a thought, you just have the thought and then it's gone. And you don't look at it, because once you start judging your thoughts,
Right.
that's sickness and shame and anxiety, that it all starts kind of perfect storm. You know what I mean? But
Yeah.
when you know, your thoughts will become your feelings and your feelings become your actions. And if your thought, especially if you suffer from some form of body dysmorphia like gender dysmorphia is, those thoughts are good, you're going to have a feeling about it, and then you're going to act in an unnatural way in dealing with your feelings.
Yeah.
If you can, and you can teach somebody how to just observe a thought and not assign a feeling to it, and to challenge it.
Yeah.
And so instead of, and I've never heard of doctors say, why don't we try therapy?
Yep. Yep.
Why don't we try talking this through and finding out why you feel that way, so then we can work on that?
Yep.
Instead, they're just throwing pills at them.
Yep.
Oh, you
Right.
have this feeling? Here, take all of this medicine that's not FDA approved. We know it's going to cause some really scary side effects that's going to fuck up your body for the rest of your life. And you're going to be beholden to big pharma for the rest of your life. And you're going to be in pain, and you're never going to experience sexual pleasure. And you're probably never going to have a normal, healthy, you know, sex life.
Yes.
And we're born to have all of that. It's
Yep.
in our blood. We're going to take all of that away from you because you're having a feeling right now in this moment.
Yep. Yep.
Back to that feelings again.
Exactly.
All back to
Yep.
that feeling.
And it says here attempt to require medical care. Basically, the suicide attempt is a lot higher in transgender male than in transgender female. A lot higher.
Was there ever any talk about therapy in any of all that? Like, you know, emotional regulation. And I mean, was there ever any talk about anybody seeking some sort of therapy before they went and did the medication. That's what I don't understand.
The old way of doing things with, you know, like people who are actually genuinely trans, because I do believe that there are people who are genuinely transgender.
Correct.
And they were required to undergo therapy, psychiatric evaluation.
Right.
It was
I think
a
it should
part
be.
of- it absolutely should be. And it's really up to the, you know, like the attending psychiatrist who's overseeing all of this to authorize whether or not the person was able to do this. So why is this not being done to children?
Yep.
Why are
Right.
they not under
Well,
psychiatric
why
care?
is it even being right? Well, why is it even an option for a child, though, especially a child from the ages 12 and under? I mean, even actually, if you want to be, for me as a parent, even, you know, until they're 18 or under. When they get out of the house, okay, maybe. But why is it even taught for a child of 8 years old? I mean, I
Yep.
just can't fathom why it's even a possibility.
Yeah, I mean that Jordan. Once again, I'm gonna read because I listen to Jordan Peterson a lot, and he just states that just like you said, Mel. What uh, he would have handled it a different way. He would have talked to them. He said, "Well, give me about 6 months," because once again, Chloe Cole, she was diagnosed with autism. She's just now died, and it was her autism that contributed. You know what I'm saying? So she just had she got diagnosed with autism. I think it was autism. So
I'm
some
definitely
do
going to go
have,
look that story up. I haven't seen it
yeah.
yet.
All what we're talking about is I go back to her because it's very heartbreaking, and you know because her story too is she looked that women were supposed to be a certain way, like voluptuous and just all perfect. You know what I'm saying?
Right.
So she, but a lot of it was geared to social media. She found the LGBT community. She all this stuff that's being pushed out now that we're seeing with, Mr. Budweiser sponsor
Yeah.
and stuff like that. You know what I'm saying? That these kids, they're they're like, oh wow, I want to be like him, or her.
Well, when you bring a kid and you go tell him it's okay, a little boy to dress in drag, or I saw that yesterday. I mean, why are we bringing kids into any of it? Let them be kids. Let
Exactly.
them live their life.
Exactly. Well, yeah. I mean, we could go on and on for hours, but it's just like it's like you were saying. It's just it's parenting. We
Yes.
we all want the quick fix. Parents. Some parents want the quick fix. Oh, my kid's crying. Give him a lollipop. Even though he don't want the lollipop, he wants attention from its mother and father. Just give him a lollipop. You know what I'm
That's
saying?
right. That's right.
Just that's like you were saying, Mel. It's neglect. You know what I'm saying?
It is.
Yeah. So we're just but we're already an hour and 43 into this. So but the Pentagon says here real quick, and then we'll play the video and another video, and then we'll stop it there. But this came out actually last week that the Pentagon doctor says a 7-year-old can consent to sex change treatment. Yeah, like multiple doctors working on
No.
U.S. military bases recently claimed that a child as young as 7 years old can consent to sex change treatment before demanding.
He don't even know
before
what
dema-
intercourse is yet at 7.
Exactly. Yep.
God, that makes me mad.
And like the military is not woke either. You know what I'm saying? It's that wokeness
No.
crap is going everywhere. It's everywhere. Yeah. When I read this, I'm like, are you freaking kidding me, bro? Like, are you really serious? Yeah. Jeez whiz. Yeah.
Parents need a
The more.
swift quick in the tail.
Exactly.
Ugh.
Yeah. And I think there's like 12 now that are what was it, Bunny? Do you what was it that banned gender affirming care? Or restricted gender affirming care. There's some states that restricted gender affirming care, like
Indiana
basically.
just did. Kentucky did. Or not. Yeah. Was it Kentucky? It must have been. Indiana. Florida.
How many states?
I think it's up to 12 now. Don't quote me on that. I think it might be up to 12. I believe it's up to 12.
Okay.
I know that my state's governor just stopped funding the Medical University of South Carolina's gender affirming clinic or whatever it was that they had.
Oh, wow.
We as parents ought to seriously start speaking up for our states because this is unacceptable.
Well,
Yeah.
I mean, a lot of people are, but unfortunately, due to social media and stuff, you get buried in the algorithm, shadow banned. And then when you go out and you try and speak up for anything having to do with stopping this movement, you know, like that female athlete that was brutally assaulted
Yep.
today, you know, a bunch of dudes in dresses that pretend to be women call her a transphobe and attacked her because she wants safety in the locker room. She doesn't want to share a locker room with some dude with a dick. She doesn't want to compete against men because men and women cannot athletically compete against each other. It's not a level playing field. And she's speaking out to protect women, and she got her ass beat.
Wow.
That's unreal.
Yep.
Outrageous.
And they call it and I was reading an article from the Guardian, and the way they made it seem like it was all these transgender, you know, this and that. They're, you know, listen, these governors are not anti-transgender. They're just protecting your kids and the dog because protecting the kids. They're protecting the kids. They don't care what it's like we tell our kids, when you're 18 years old, you can do whatever you want out of our house. We have no control of it. You know what I'm saying? Right. And that's what basically the governors are just saying in layman's terms. You know, you can't do this to kids like from 8 years old to like 16 or 17. I mean, wait until they're 18 at least. You know, some states they just restricted it, but
yeah,
they didn't totally ban it. You know what I'm saying? That's a big difference. Again, wordplay.
Right.
Big difference.
Absolutely.
But yeah, but one more thing before we go. I want you parents to actually reflect on this, because even though this clip is 4 years old, it's still will hit a nerve in you. Just think about this before. I'm not telling you what to do. We're not telling you what to do. We're not to do with your kids, but we're just telling you, think about it before you do it. Like, just don't jump on that. Hey, I'm with you. Blah, 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 solidarity this. No. Think about what you're doing to your kids, man. Because at the end of the day, we all got to look at our kids in the eyes and account. You know what I'm saying? You know, because there's some kids that be like, Mommy and Daddy, why did you do this to me? You know what I'm saying? Some are having regrets. But like Buddy was saying, like Buddy was saying, they're being drowned out and being called the transitioners, being called transphobic, blah, 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 being censored, you know, stuff like that. It's ridiculous.
It is.
Yeah.
Poor Justin. I want to be on the podcast.
Well, yeah.
Well, he has a 2-month-old.
Yeah. Yes, he does. You're right. But next time, Justin, we'll talk because I'm planning to do something on the Federal Reserves. I want to do a
You need him.
yes.
100%.
I was gonna have him. I'm thinking of him and some other dude I'm following on TikTok. But yeah, oh my gosh, it's crazy. But yeah, just parents, just think about this clip. Wait, just think about it. If this doesn't change your mind, if we don't challenge the way you think, this will definitely change how you think. Check this out.
Good.
Oh, I'm sorry, hold on. You guys don't hear that, right? I'm
No.
sorry. My bad. Here you go. Now, this is the mother who had her kid transitioned. Here we go. And now basically regrets.
Is affirmative care. The current standard of treatment promoted by medical and psychological associations is called affirmative care. Well, this sounds nice. Affirmative care leads directly to putting children on the path to medical transition with little chance of turning back. Let me explain to you how this works. If you take your child to a clinic to seek help, affirmative care means the therapist must follow the child's lead. The professionals must accept a child's gender identity. In fact, this is the law in many states. Under conversion therapy bans, questioning a child's gender identity is now illegal. So if a little boy is 5 years old and believes he is the opposite sex, affirmative care means going along with his beliefs. Parents are encouraged to refer to him as their daughter and let him choose a feminine name. Teachers are told to let him use the girls' bathroom at school. Therapists will reassure parents that social transition is harmless and reversible. Is it really harmless to tell a child who still believes in the tooth fairy that he is the opposite sex? Isn't it quite likely that this child is just confused? If a 10-year-old girl is uncomfortable with her developing body and suddenly insists she is a boy, affirmative care means blocking this girl's puberty with powerful drugs. Doctors will tell parents this is a perfectly safe and reversible way for her to explore her gender. Affirmative care does not help this child get to the cause of her discomfort. Medicating her with these drugs is not safe. In fact, her future fertility, sexual functioning, and bone development may be negatively impacted. Once the teenage years begin, affirmative care means giving young people cross-sex hormones. Girls as young as 12 are prescribed testosterone for lifetime usage, while boys are given estrogen. These are serious hormonal treatments that impact brain development, cardiovascular health, and may increase the risk of cancer. There are no long-term studies to prove this is necessary, safe, or prudent, while there are many known hazards using these same hormones when medically treating adults. What does affirmative care look like? This is what is called gender affirming top surgery, also known as a double mastectomy. They are performed on girls as young as 13 years old, otherwise healthy girls who believe they are transgender. This is a picture of a woman's arm after the skin and other tissue was removed to fashion a fake penis. Jazz Jennings is an example of affirmative care. Jazz was born a boy but raised as a girl since the age of 5. He was treated hormonally since age 11. Last year, at the age of 17, Jazz had surgery to remove his penis and create a simulated vagina out of his stomach lining. After surgery, Jazz's wounds began separating and a blood blister began to form. An emergency surgery was performed. According to Jazz's doctor, As I was getting her on the bed, I heard something go pop. When I looked, the whole thing had split open. This is a picture of Jazz's face in pain from these surgical complications. This is a medical experiment on a child that has been playing out on television for the past 12 years. No one knows what might happen next. There are teenage girls undergoing radical hysterectomies in the name of gender identity. It is not acceptable for doctors to remove healthy limbs from children, so why is it acceptable for doctors to remove healthy reproductive organs from children? I am here today not just because I care about children who identify as transgender, but because I also care about their parents and other family members. Parents are doing everything they can to help their kids lead healthy, happy, and fulfilling lives. Yet when parents seek out experts for help, they receive a one-size-fits-all narrative that has no basis in science, common sense, or compassion.
Yep.
The experts tell parents that it is harmful to question their children's beliefs, that they must support their children's medical transition, which includes a lifetime dependence on hormones, and that if parents do not comply, their children will be at higher risk of suicide. These parents are being lied to,
Yep.
as their children are harmed and their families are torn apart. Why not help children learn to love the bodies in which they were born? Isn't that what the body positivity movement is
Yeah.
all about? I traveled across the country today to speak here to make a difference. I hope that my trip was not in vain. Transgender identifying children need our compassion and they need our help. They need responsible adults to gently question their beliefs, not blindly affirm them. They need proper therapy and guidance, not drugs and surgeries. And the medical practices that are abusing them need to be shut down. Please speak out for these children. As I stated in the beginning, I am speaking out because I love my daughter. And it is because of her that I know what I have told you today is true. She has been a victim of gender-affirming medical procedures, and I was powerless to stop doctors from harming her. Someday, I hope she will realize that I am advocating for her health and for her future. She has incredible courage, strength, and tenacity, as do many transgender identifying youth. We, as parents of these young people, advocate for our children because we love them. Many of us are going through unimaginable grief because we love them. We are standing together and we will never back down because we love them. We parents have formed our own support groups and a new coalition, the Kelsey Coalition, to help spread this message and change the systems that failed our children. Will you please stand with us?
Yeah. Yep, that's a tearjerker. But it's true though.
Yeah, it really is.
Yeah.
A
Hold on.
topic that
All right, get off. All right, there you go. There you go. Why are you still going? Bruh. Okay. Hold on. Yeah. Yeah, that's oh come on, bruh. There you go. Yeah, that's definitely a tearjerker. It's crazy.
It's sad because we as parents need to do better.
We have to. You're right. 100% agree.
Not just for our kids, but for us, our grandkids, everyone involved.
Yeah. Yeah, exactly. So, all right, guys. Well, I wanted to thank. We're just about 2 hours, and I'm sorry, buddy. I apologize. Want to gouge out your eyes yet?
I'm pretty close, dude.
I'm
I
sorry,
want to
but
go see my fiance. I want to eat. I
Okay.
love you.
No, same here.
Love
I need
you.
a cigarette myself.
And thank you, but I need to eat.
No, I got it.
Need to
Yes.
eat.
Okay. Well, thanks for joining us. Thanks for coming on my show, guys. I really appreciate it.
Thanks for having me.
Apologize. Yeah, you're welcome. Apologize for the first half hour, but hey, we got through it. But I appreciate you guys for coming on, and my door is always welcome to you guys. So if you guys want to come back on, and more appreciate it. You got it.
All right.
All right. Liberty Podcast, we are out. Hey guys, if you really like my content, go ahead and smash the heck out of that sub button. Little disclaimer, I'm not responsible for any damages to your computer or your cell phone devices. Just thought I'd let you guys know. But also, hit that like button. Yeah, give it a thumbs up and all comments. I want to know what you guys are thinking. It'll drive me up there in the algorithm. To all the big dogs up there. Yeah, big dogs, I'm coming for you. Ugh! All right, guys. Peace. Yes, I want to end broadcast.